So I have so many other questions, but one of the question where students usually worry a little is obviously tests and exams.
So the assessment system is very, let's say that we have a lot of tools to assess the students. Mm-hmm. And it's not like the standardized for all subjects. No. Mm-hmm. Each subjects have own assessment tools. It depends if it's a theoretical subject, it is a clinical subject, and we are using all modern methods which nowadays USA or European universities are using for the assessment the medical students. Mm-hmm. And for example, first, second year students on the block-based system, they have assessment in laboratory works. Mm-hmm. They should come and do something by themselves. Mm-hmm. And they are very happy when they are staining some bacteria for oral cavity and seeing them under the microscope. It's like the gaming and studying together. Mm-hmm. They should assess in the PBL, which is one of the integrated method to assess students. Mm-hmm. They have assessment in cadaver classes because we have cadaver, and they study normal anatomy, clinical anatomy on the cadaver. Mm-hmm. And they have spatial practical assessment on the cadaver classes, and they assessed by the presentation. They are preparing the integrated presentation, mm-hmm. Group presentation, yes. And they are assessing. It's an assessment for the assessment tools for the first, second years. Mm-hmm. But in higher classes, yes. Depending on the practical part, there are DOPS, for example. This is a directly observed procedural skills, how the students performing the procedure. Mm-hmm. On mannequins from the beginning, because on the third year of education we have good medical practice 1 and 2, mm-hmm. and they should do everything on the mannequins and simulators, mm-hmm. and pass the OSCE exams, otherwise they cannot go to the clinical practice and do the same on the patient. Okay. They should have high scores on the OSCE exams, mm-hmm. and then they are allowed to go to the clinical practice. Mm-hmm. And OSCE exam, again, it's a most funny type. It's a little bit precious, but less pressure than theoretical exams, because they are acting as a doctors. Mm-hmm. And they perform everything on the mannequins, and I think that it's one of the best tools to assess students' clinical skills. Mm-hmm. Okay. On clinics, we are using on the 6th year of education 360-degree assessment, which means that students will be assessed by the nurse, by patient relatives, doctor, and even classmates. And the assessment is a workplace-based assessment, or mini clinical exams when students should manage the patient from beginning till the end. Mm-hmm. Not only one procedure, but from the beginning, from the starting from the communication till the sending to the some laboratory or instrumental investigation, mm-hmm. And physical examination as well. Mm-hmm. So there are a lot of variety of tools which allow students to show the knowledge and to show the skills. Okay. We have simulated patient. It's a software. Mm-hmm. It's a body interact software. Mm-hmm. It's very good table where is lying the patient. It's a animated patient, mm-hmm. but it contains a lot of information about this patient. All laboratory analysis results, instrumental investigation results. Even the patient can answer the question when you are asking. You should choose from the list of the questions, proper question, and patient can answer it, and you can order analysis, and the table shows all result of analysis, even wrong analysis which should not be ordered. Yeah, and at the end of the session there's a debriefing, and the system shows the feedback. Which wrong question you asked, which question should be asked but you didn't, which analysis you order, which is expensive and not cost effective, and it shows all. It's like the real situation with patient. And it's not harmful for patient because students cannot do everything with patient, really. Yeah, on simulated patient it's possible to do everything, and it's standardized for every students. It means that we can check all students on the same level. And it's interesting for students because of it is limited in time. And in an emergency situation, we can see how there's a sounds of
it's in the computer.
It's like the big computer table, yeah. And even on the pediatry, when baby is crying and not allowing you to make a physical examination,
it's stressed.
It's effect on the students. It's effect really. The sounds, real sounds, the real pain when patient said that it's painful. So it's like the real situation with real patient. It allows us to see how they act, how is the student behavior in the limited time under the stress situation. Okay, as you know, in Georgia there are 6-year one cycle medical education. They are studying 6 year. The last year is a totally internship, totally. There is no any lecture, only elective subjects, which can be chosen by the students. They spend all time in the clinics. And one more good thing is, I think that best students who have very high GPA and very good portfolio, because our program has additional part of portfolio where we are collecting the information about students' extracurricular activity, for example, participation in the conference, or publishing some articles, or maybe making some internship with not inside the program, outside in their countries or somewhere else, or work as a volunteer in some maybe orphanage or something else. So we are collecting everything. Same time, portfolio contains the self-assessment part, when student assess himself or herself, which knowledge they have, what they should improve. And they get feedback from the teachers too. All teachers who taught them, they assess the students, and then the tutor collect all information about the students and give their plan. What's wrong with these students? We are not talking about knowledge. We are talking about communication skills, about attitudes, about behavior. Even in portfolio is mentioned how the student communicate with classmates, how how is their behavior in the groups,
like their social development.
Because you know that it's one of the big part and important part of the doctors. Yeah.
Yes.
Without this part, knowledge will not show. There are many doctors who are the brilliant.
But
doctors, zero social skills, and none of the patient want to go to talk with. Oh, I don't want to talk with this doctor. Please ask, despite of me. So this is one of the big part of our curricula. It's a portfolio, and in portfolio, if the portfolio is good, and if the GPA is high, we are announcing the competition, and we are choosing the student for to send them in Bahçeşehir University for the taking the clinical practice in the network of because Bahçeşehir University have good and big network of the clinics, and we are sending students for the rotation for short period or long period.